One by one, hospital systems sounding the alarm about what they are able to handle as COVID cases keep rising in Michigan. Off the top at 6, when hospitals reach near capacity, the consequences are not limited to the people who have COVID.
It truly affects everybody who may need medical services. We've been showing you the state's 7-day moving average of cases to illustrate what's going on this month. It's now up to around 7,000 cases per day.
Take a look at this, though. Today, Beaumont Health put out this chart showing the steady climb of positive COVID test rates since summer. It was 3% July 1st, now standing at 14%. Healthcare leaders have been saying that hospitals have been under strain for months, but now the level of concern has grown even more dramatically.
That's right. They're asking every Michigander to do their part to help hospitals help us. Dr. Frank McGeorge joins us to explain how critical things have really become, Doc.
Yeah, Kim and Devin. So the current situation is actually a combination of many factors, but two stand out. Staffing shortages that limit hospital bed availability and more hospitalized patients with non-COVID medical problems. But of course, that is on top of quickly skyrocketing COVID cases.
Our situation in Michigan hospitals today is frankly as dire as it has been since the start of this pandemic.
Is it to the point that if this doesn't turn around, people could needlessly die?
Well, there's no question.
That's Brian Peters, the CEO of the Michigan Health and Hospital Association.
What are you hearing about the ER situation across the state? I mean, basically, how perilous is it right now?
Perilous is a great word to use because we have seen a nearly 40% increase in daily emergency department visits in Michigan hospitals, and that's a statewide number. In some of our hospitals, that number is even more severe.
When does it get to the point that some people simply won't be able to get the care that they need when they need it?
Well, quite honestly, we're approaching that situation now in some regions of the state and with some hospitals who are at maximum capacity. When you literally have beds that are filled and staff that are burned out, where do those patients go when a hospital and all of the hospitals in a particular region are filled? And this is why we absolutely need the public's support in terms of all of the protocols that we know can help mitigate the spread of this pandemic.
And with Thanksgiving approaching,
if you are not vaccinated, if you're not using those masking and social distancing protocols, this could only pour fuel on a fire that's already burning much too hot at this point.
Now, the danger right now is different than at the start of the pandemic when we were worried about things like running out of ventilators. If you come to the hospital, we will keep you safe. But hospital beds and ER space, they are at a premium, and that's if we even have hospital beds available. Slowing the COVID surge will help simply make everyone safer. It's up to all of us. Back to you.
It is a dire situation. Okay, Dr. McGeorge, we appreciate